Hi there, everyone, and welcome to MedTech by Medical Tourism. And we have here as our guest Dr. Maria Digna Barahona. She is a gynecologist that has her practice in Mexico City with over 7 years of experience. And we're going to talk about an issue that's called adenomyosis. Did I pronounce it correctly, doctor?
Perfect.
It's an issue that occurs in a lot of women. Hi, doctor, and thank you for joining us.
Hello, thank you for the invitation.
Can you please explain to us what is adenomyosis?
Simple words, adenomyosis, it's when we have tissue that's located inside the uterus that for some reason migrates to the uterine walls. And this grows in this part and usually tends to present with very irregular and heavy bleeding and a lot of menstrual cramps.
Do you know why does it occur?
There are various theories of why we have this pathology. One of the most famous one is that we have like a menstrual alteration where instead of the menstrual bleeding coming through vagina, it goes directly to the uterine walls. Also, we have another theory that includes uterine traumas, like when you have procedures in the uterus, and this increases the risk of the endometrial tissue to go to the uterine walls.
And if I have this adenomyosis, is my fertility in any risk?
Actually, yes. There's various reports of patients that when they present adenomyosis, they do have a very high risk of fertility alterations.
So I know I have this. I already went to the doctor and I did try medication and it didn't work. So I'm looking for other options because, well, as you mentioned, it's uncomfortable to have it. What other treatments or surgeries or procedures can you guys offer all the way in there in Mexico?
Okay, so we have various treatments. We classify them ones like a non-invasive treatment and the invasive treatments. The non-invasive treatments include hysteroscopies, which is a procedure where we look inside the uterine cavity and we can make resection of adenomyosis. Also, we have another procedure that is called HIFU, which is a procedure that includes the use of the ultrasound waves, and this practically coagulates the adenomyotic lesions inside the uterus.
Okay. So if I have this and I want to have one of those treatments, if I do the first one, how much time do I have to stay in Mexico? Should I schedule a video consultation with you guys? What will be the protocol for me being outside of Mexico and wanted to have one of these procedures done? Can you please separate both of them and times, recuperating times, and when can I get back home?
Yeah, usually if you're overseas or not in Mexico City, what we usually do is that we have an online appointment to get to know you better, to get to know you and gather all your medical history, all your surgical histories. And if you have ultrasound images or labs, they do help us a lot. So we can see where's the lesion located and offer you all the options. Once we have the online appointment, we organize and we program ourselves to receive you here, where we do perform a physical exploration, an ultrasonographic evaluation, and if we require some other studies like a magnetic resonance, we do perform it. That could include like 1 day, and if you do need or require the hysteroscopy or the HIFU, the next day or the same day, we can perform it.
We already have this conversation in Spanish, so I already knew a little bit of the subject, and this is another segment for you guys in English. So if I decide the endoscopic way, is it general anesthesia? Do I have to go to the hospital? Is it done in the clinic? Can I walk out of there? Is it an overnight stay? Can you provide all that information, please? And how can I determine if I'm a candidate for that specific treatment?
Okay. To determine if you're a candidate, we do require to have images and labs, okay? That's like the number one step, and to know all your medical history, okay? If you are a patient that you are a candidate, let's say, for a hysteroscopy, the hysteroscopy can be performed in a medical office. And we don't usually use analgesics or sedation. After the hysteroscopy, you can go home. Let's say we perform a hysteroscopy in a surgical room. You do need anesthesia and you usually stay approximately 12 to 24 hours. In case you are a candidate for laparoscopic surgery, you do need to stay at least 24 hours in hospitalization. And after that, we do require a follow-up of at least 7 days, okay? But this we can manage it to diminish it according to how you evolve throughout the post-operative days. In case you perform the HIFU procedure, usually this procedure, after 2-3 hours, you go back home.
What can make me a candidate for HIFU? Because a lot of people in this segment in particular that are overseas are interested in all the things that are being talked about and said about HIFU, how it minimizes time, how it offers minimum risks compared to other procedures. Can you please explain us a little bit more regarding that to our abroad audience?
Yeah, since this is a non-invasive procedure, meaning we don't make like any cut in the skin, you do require of a evaluation previous to the procedure. Okay, we do this procedure and we evaluate, number one, the location of the lesions, your bladder. If it works, we do work a lot with the bladder in the HIFU. And this would let us know if you are a patient that could have this procedure done, okay? Another thing that's important about this procedure is that in case you're overseas, it can be done in the same day. In case you are not a patient for this procedure, we would offer you like some other options. Or sometimes we assign you to make some bladder exercises that would help a little bit to make you a patient candidate for this procedure.
The other time that I was speaking to another doctor regarding this type of procedures, they say that they were treating another thing, intestines could get in the way. So they cleaned the intestines prior and then they did some sonograms and then determine if that will help being candidates. It's that kind of what you're saying, like it's the same thing. So you move the bladder out of the way to see if you can throw the beam there.
Yes. Actually, before you come to the procedure, you do need to have, number one, a fasting of at least 8-12 hours. Also, we do perform some intestinal preparations. And the bladder, it's really, really important. Once we place you in the HIFU machine, we evaluate the bladder and we also have to see that the intestines are away from a working area.
So if it's clear, good to go. Okay. And after my treatment, if I do the HIFU, how long do I have to stay in Mexico?
Most of the patients, after the procedure, they can go back home approximately 2 to 3 hours. But 2 to 3 hours, they can go back home or to their hotel. And we do emphasize about a post-surgical evaluation, like 1 day or 7 days at least.
And after that, I'm free to go.
After that, you would be free to go. And we do have some monthly follow-ups. But if you have like your gynecologist, you can get like this follow-ups without trouble.
If in my life plan, it's to have kids and I have adenomyosis and I want a treatment, do you suggest that I go and freeze my eggs before I start the procedure?
If you have a fertility problem, number one, the best thing you could do is identify like which are the factors that are affecting your fertility. Get an evaluation by a fertility specialist. And according to this, if they suggest you to do this procedure, yes.
Thank you very much, doctor, for your time. Is there anything else you would like to add for our abroad audience?
Something that would be important is to tell like all our female patients and every also men that you have to get an evaluation at least every year by your doctor to identify any diseases in a very early stage and have an adequate treatment.
Well, thank you very much for your time, and thank you everybody for listening. I'll leave in the comments the link to the information of the doctor. So you have any further questions, you can get in touch with her regarding this topic or any other if you're planning a visit to Mexico City and want to visit a gynecologist. Thank you so much, doctor.
Thank you.
After my conversation with Dr. Maria, I can conclude that the adenomyosis is a condition that can make the menstrual cycle very uncomfortable with a lot of pain and heavy flow. But nowadays, there are a lot of treatments that can help reduce or minimize those symptoms in just one session.